Hi there, my name is Steve. I'm from Ocala Nutrition Center. I am the certified nutritionist here at Ocala Nutrition Center. And so what we're going to be doing is we're going to be starting a series of nutrition topics that are going to help you answer some questions, just typical questions that people have in regards to these products and what they're really used for and what the advantages and disadvantages of nutrition is for maximizing your goals and maximizing certain medications you may be on also for weight loss. So we're going to start off our topics with a very hot topic now in the supplement world, which has to do with GLP-1 agonists. Those are weight loss medications. They're kind of a class of medications that mainly help manage your blood sugar, glucose levels in people with type 2 diabetes. And some of these GLP-1 agonists also are there to help treat obesity too. GLP-1 agonists are most often injectable medications. That means that you're injecting a liquid medication with a needle or syringe, and you're getting your shots really into like fatty tissues of your skin, and areas of the body that you can give injections. Can be the belly, outer thigh, upper buttocks, and the back of your arms. These medications typically are relatively new. The Food and Drug Administration approved their use of the first GLP-1 agonist back in 2005. Researchers are still learning about other potential uses and benefits for these GLP-1 agonists. They don't always, so let's try it again. GLP-1 agonists alone can't treat type 2 diabetes or obesity. Both conditions require other treatment strategies along with the medications such as lifestyle and dietary changes. What are the types of GLP-1 medications we're seeing currently in the United States? Things like Trulicity, Victoza, Ozempic, Robellis. Those are classes of medications for GLP-1 receptors in your body. There's also another medication that's on the market, a trizepatide, which is called Mounjaro, which is also currently being used too. All right. So how do these GLP-1 agonists work? So to get that understanding, we need to know in your body, GLP-1 hormones are being produced mainly by your small intestine. And what happens is that it triggers insulin release from your pancreas when it's present. Insulin is an essential hormone that's used by your body to use the food that you eat for energy. It lowers the amount of glucose, sugar in your blood also. So if you don't have enough insulin, your blood sugar increases, leading to diabetes. Another thing the GLP-1 agonists do is they block glucagon secretion. Glucagon is a hormone in your body that's used to raise your blood sugar levels when necessary. So when there's GLP-1 there, it prevents more glucose from going into your bloodstream. Another thing that GLP-1 agonists do is it slows stomach emptying. Really important is that your digestion process will slow down when we have this GLP-1 agonist around there. And so it's going to be really important when we talk about nutrition that you're starting to develop different eating habits in regards to this slower digestion. The last thing that GLP-1 agonists do is they increase how full you feel after eating. They do affect that area of the brain that processes hunger and satiety. So it's going to help you feel fuller, which is going to decrease the amount of eating you do. If you have type 2 diabetes, the medications help manage your blood sugar by triggering your pancreas to release more insulin. And the slow digestion also decreases blood sugar spikes too. The satiety effect of the GLP-1 agonists reduce your food intake, as we talked about, appetite and hunger. And all these are combined together effects that often result in weight loss. The question comes up is, when do I need to take a GLP agonist? Okay, healthcare providers provide these GLP-1 agonists for two conditions: type 2 diabetes and obesity. So the FDA first for type 2 diabetes has approved the use of these GLP-1 agonists to help manage type 2 diabetes. This is because GLP-1 agonists help lower blood sugar levels. There are several other diabetes medications, like an oral one taken in the mouth, and those oral medications, primarily metformin, is the go-to medication for treating type 2 diabetes. But your healthcare provider may recommend GLP-1 agonists if the metformin isn't helping manage your type 2 diabetes. It's unsafe for you to take the metformin. You have a contraindication. or if your A1C is higher than your target, and if you haven't reached your target A1C within 3 months of treatment with metformin, or if you have additional conditions like atherosclerosis, heart failure, or chronic kidney disease, these GLP-1 agonists are more effective for managing your type 2 diabetes. Remember, it's important that the most effective management of type 2 diabetes involves several other therapies, like lifestyle, diet modifications, exercise, and the medications that we use to prescribe for type 2 diabetes. So together, you and your healthcare provider will determine a treatment plan that works best for you. Providers often prescribe GLP-1 agonists with other medications to achieve the best blood glucose management. What if I have type 1 diabetes? Can I take these GLP-1 agonists? Research currently studying the safety and effectiveness of these for type 2 diabetes. So far, the studies have shown that these medications can help lower A1C in type 1 diabetes patients, and with the help of weight loss in people, and also help with weight loss in people with type 1 diabetes. The FDA hasn't approved it for the treatment of type 1 diabetes, but some healthcare providers have been prescribing it off-label. So talk to your provider if you have type 1 diabetes and see if this is an option for you. GLP-1 agonists to treat obesity. The FDA also currently has approved the use of semaglutide and high-dose liraglutide to help treat obesity. This is because these GLP-1 agonists have weight loss effects. Obesity in the United States is a chronic condition in which you have a body mass index of at least 30 or higher. That's a BMI. So what obesity is, as we mentioned, is a complex condition, and effective management, just like with diabetes, requires several other therapies, such as dietary changes, exercise regularly, medications, behavior modification programs, and even sometimes bariatric weight loss surgery. So if you have obesity or overweight and have been struggling for weight loss, talk to your healthcare provider to see if these GLP-1 agonists are going to be a good fit for you. What are some of the potential benefits of GLP-1 agonists? Other than lowering blood sugar levels and reducing weight, studies show that GLP-1 agonists may have other potential benefits like lowering your blood pressure, improving your lipid disorders, improving fatty liver disease, reducing your risk of heart disease and kidney disease, and delaying the progression of diabetes-related neuropathy in your eyes. Some of the side effects of these GLP-1 agonists: most common side effects are loss of appetite, nausea, vomiting, and diarrhea. So they are primarily related to gastrointestinal upset, and those are primarily the ones that we see the most. There are other side effects you can get, such as dizziness, mild increase in your heart rate. Sometimes you get increased risk of infections, headaches, indigestion, upset stomach tends to be the most common. Sometimes you can also have a mild temporary illness, itchiness, or redness in your skin at the site of the injection. Severe but rare can include things like pancreatitis, medullary thyroid cancer, acute kidney injury, and also worsening of diabetes-related retinopathy. There are some risk of complications with GLP agonists that are even more concerning, and they have to do with allergic reactions, and also the use during pregnancy is not indicated, and if you already have low blood sugar levels, hypoglycemic, you're really not recommended to take these medications. If you notice a persistent itchiness, redness, or other symptoms of an allergic reaction at the injection site, talk to your healthcare provider. Some symptoms of anaphylaxis can develop with these medications. Call 911 or get to the nearest emergency room of symptoms such as shortness of breath, wheezing, hives, difficulty swallowing, abnormal belly pain, chest tightness, a feeling of doom or dread. Those are all symptoms that need immediate attention. One question comes up is, when should I call my healthcare provider? You should have regular appointments with your healthcare provider when taking these GLP-1 agonist medications to assess how well it's working. Otherwise, talk to your provider if the following situations develop. If you develop bothersome side effects, if you don't think it's working, you manage your condition. If you think of stopping the medication, it's really important to let your healthcare provider know that. Or if you become pregnant or are thinking to become pregnant, that's another condition to talk to your healthcare provider for. So now we're talking about my favorite part of the seminar, which is going to be nutrition, because nutrition is one of those key factors that's going to make the success of what you're doing in your GLP-1 agonist medication treatment successful. All right. And why does diet matter when taking these GLP-1 agonists? Okay. So by following a balanced diet and lifestyle, you can support the natural release of GLP-1 in your body. This can work alongside the GLP-1 medications that your doctor is prescribing in managing your blood sugar levels and weight. Research suggests that combining lifestyle changes, the medication, and diet changes to improve the levels of GLP-1 could help manage your type 2 diabetes more effectively and lower the risk of long-term complications associated with this condition. What types of foods do you want to not consume while you're on the GLP medications? Okay, these foods are really not a good thing to do, because what they'll cause is what's called a rapid spike in your blood sugar levels, and it's going to lower the GLP-1 medication's effectiveness. Things like sugary foods and beverages like juices, sodas, and alcohol. Refined carbohydrates like white bread and pasta, and high-fat foods, things that are high in saturated fats. Those are not good things to be consuming on this medication, because it's going to increase not only the side effects you're going to get in digestive upset, but it's also going to decrease the results you're going to get in regards to that too, because it's going to result, when you have a high amount of sugar intake, you're going to experience the smallest increase in GLP levels in your body following this sugar consumption. Okay, GLP-1 medications do help reduce cravings for food with fewer nutrients, and by promoting a feeling of fullness, these medications can help support dietary choices, as you're less likely to feel hungry and crave a high-calorie diet and low-nutrient foods. This can also help with weight loss and improve overall health. The bottom line is that these medications treat type 2 diabetes, and in some cases they treat obesity. They work by mimicking the action of your hormone GLP, which helps regulate blood sugar levels in your body. Having a balanced diet while taking the medications is important to manage blood sugar levels. Try to focus on foods that are rich in nutrients, limit sugary and high-fat foods, and listen to your body's signals for fullness to make you a more nutritious dietary choices. So we talked about the things that you do not want to consume when you're on these GLP-1 medications. Now we want to talk about what's the best diet to follow while you're on this GLP-1 medication. The best diet to follow is one that focuses on whole, minimally processed foods. So whole foods that are minimally processed. So people that, the research is indicating that managing type 2 diabetes involves focusing on a diet rich in high fiber foods like vegetables, fruits, legumes, which are beans, and whole grains, while limiting the intake of saturated fatty acids. Instead, you want to eat more of what are called unsaturated fats, monounsaturated and omega-3 polyunsaturated fats. These can potentially increase your GLP-1 secretion, which is beneficial for the management of type 2 diabetes. One of the best foods to eat while on these medications include things like eggs. Eggs are rich in protein and monounsaturated fats. And as we talked about, these can trigger the release of GLP-1 and other hormones that can help you feel full. They also contain many vitamins and minerals that can support your overall health. Healthy fats. Healthy fats, such as those found in avocados, nuts, olive oil, are rich in mono and polyunsaturated fats, and these stimulate the release of GLP-1. They are also important for brain health and hormone function. Whole grains. Whole grains such as oats, brown rice, and quinoa are high in fiber, which can help improve digestion and regulate blood sugar levels. They also provide a steady source of energy throughout the day so you don't feel tired. Berries, such as blueberries, strawberries, they're rich in antioxidants, which can help lower inflammation and improve overall health. They are also low in sugar in comparison to other fruit choices. Legumes. things like beans, lentils, chickpeas are high in fiber and protein, which can help regulate blood sugar levels and promote digestive health. Vegetables like broccoli, carrots, Brussels sprouts are not only low in calories and rich in nutrients, but also they're high in fiber and potentially helping to release the GLP-1 and regulating blood sugar levels. Leafy greens such as spinach, kale, Swiss chard are also rich in fiber, vitamins, and minerals, and they can help you regulate blood sugar levels and improve your overall health. So these are good nutritional points that we want to make sure you're talking about with your primary care or a certified nutritionist like I am with the Ocala Nutrition Center. We can help to guide you in the best possible choices to allow you to get the best possible results in your weight loss journey. So we have our contact information down below, and you can feel free to reach out to us in regards to any questions or really starting to develop a program. We like to use things like MyFitnessPal to help people track and make sure they're monitoring what they're doing in a daily intake. That helps us to determine when you send us that MyFitnessPal at the end of the day, it gives us a summary of your calories. It also gives us a summary of your macro breakdown, and that helps us kind of guide you and tweak things so that you're getting the maximum benefits out of your blood sugar levels and also the maximum benefits out of your weight loss journey with these GLP-1 medications. So as I said, the phone number is down below, and our contact information is also on the screen here too. So feel free to give us a call, and we can work with your healthcare provider to make sure you're getting the best possible results with these GLP medications.